Alright, so today I'm going to be talking about how to measure heart rate and blood pressure on a patient. And so first thing we're going to do is start with heart rate. And ideally what you want to do is have your patient be sitting or laying supine for about 5 to 10 minutes prior to the heart rate and BP assessment. And that is just to get your vitals in a resting position. So we're going to start with heart rate, and what you're going to want to do is use your index finger to palpate for the radial artery, and that's going to be just proximal to the wrist. And it's important to use your index finger because your thumb has a pulse of its own, and so this can oftentimes get confused with measuring the rate. So what you're going to do is find the little groove just proximal to the wrist, and you're going to use that with your index finger. And you can just have them rest, relax their arm, make sure it's out straight but not completely extended. And you're also going to set a timer for about 15 seconds, and then you're going to count the number of beats that happen in 15 seconds and then multiply that by 4 to get beats per minute. So we're going to demonstrate that right now. I'm going to find the pulse and start the timer. All right. So there was 17 beats, and so you're going to times that by 4 to get 68. And so that would be considered her resting heart rate. And also it's important to know that a lot of times people will want to palpate the carotid artery to get the heart rate, and this isn't a great idea because you can stimulate a vasovagal response, which is stimulating the sympathetic division of your nervous system, which can cause your heart rate to slow excessively, and is especially important not to stimulate during exercise. So next thing we're going to do is talk about blood pressure and how to measure that. Normally in lab we would use a sphygmomanometer, but because we don't have that, we're just going to talk about the basic protocols on how to use it. So again, like heart rate, you're going to want to have them sitting for about 5 to 10 minutes prior to the assessment. You're going to want to get their arm and find their brachial artery, and that's normally just below the belly of the biceps, and you can find that pretty easily with your fingers, and you're going to want to find that pulse. And once you do, you're going to want to put the cuff around that the arm, the brachium here, and you're going to want to make sure the artery is lined up with the pulse that you find. Next thing you're going to want to do is pump the cuff up to about 30 or 40 millimeters of mercury past normal blood pressure, which is going to be in the 160 to 170 range. So once you have that inflated, you're going to want to make sure you can fit 2 fingers in really snug, and if it's not that snug, then you're going to want to tighten the cuff. So once you have the cuff fully inflated, then you're going to want to put the stethoscope right on the antecubital area, and you're going to want to make sure you have your listening device in. And once you have that pressure all the way up to about 160 or 170, you can release the pressure and the air will come out. And what you're going to be listening for is that first blood pressure sound, and it's called a Korsakoff sound. And what that is the first sound you hear is going to be the systolic pressure, and then you're going to continue listening until you hear the last sound, and that's the diastolic pressure. And this is just going to be your basic blood pressure. A normal healthy value is anything lower than 120/80, and anything over that is considered prehypertensive. And additionally, for the heart rate, in the last assessment, any value in the range of 60 to 100 beats per minute is considered normal, and anything under that is going to be considered bradycardia, and anything over 100 beats per minute is going to be considered tachycardia. Aside from that, that is good.